Alaikum warahmatullahi wabarakatuh. My name is Hassan Bazer. Today we will talk about optimizing outcomes through medication adherence. If the patient had been taking medication at the required time and the right dose, as in the prescription, he or she can enjoy the life with their family and children. Now we will see the objective. There is six goals. 1. Competitive between adherence and complements. 2. See the benefits of the medication adherence. 3. Discuss the reason of the and the problem. 4. Categorize factors of the medication adherence. 5. Explain the measurement and the methods. Last one, describe the strategy to how increase and improve medication adherence. This is the work group. Let's begin our journey of medication adherence. Medication adherence related to patient with time, dose, and frequency on the instruction of the physician. There are many important factors of the medical treatment like therapeutic range of the drug, but the most important factor is the enhance of medication adherence. Let's take an example. Antihypertensive of drugs to control blood pressure, but if there is lack of the adherence, which lead to increase the risk of the chronic vascular disease. And now terminology. Competitive and differentiate between complements and adherence. Adherence is the extent to which patient treatment-related behavior, for example, take a medication following a diet, modify habit, or attending clinics, correspond to professional advisor. Complements the extent to which patient follow the instruction and prescription given by professional or to extent to which patient behavior matched with the prescriber's recommendation. Benefit of medication adherence. There are many benefits of medication adherence and I check some of it like enhance safety of the patient cause it will be in the therapeutic range, reduce the cost of the treatment, improve quality of life because the drug will be always at the therapeutic range and it will give you more gain life. Reduce risk of drug resistance due taking the drug on time and the required dose. Because if the patient miss it or they don't want to take it, the infection will gain a resistance to the drug. And this was my section. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. My name is Bashir Ferrer. Today I will talk about the problem of medication adherence and 5 dimensions or factors that affect in medication non-adherence. So we'll start about problem of medication adherence. We have 5 problem of medication adherence. Number 1, increase the remission to hospital. Number 2, development of complication. Number 3, increase the cost of treatment. Number 4, reduce the quality of the life. Number 5, may lead to death. that problem of medication adherence.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdurrahman Muhammad Murzam al-Muntashri, and I will talk about type of non-adherence. There are three types of non-adherence. The most common type of non-adherence, known as fulfillment adherence, while non-persistence rarely occur. In fulfillment adherence, the provider writes the prescription, but the medication is never started or filled. While non-persistence, after medication is started, the patient tends to avoid taking it without health professional counseling them. It's occur if therapeutic plan miscommunication by provider and patient. And the third type, non-confirming. This type occur by taking the medicine at wrong time, incorrect dose, also taking more than prescribed method, in which drugs are not taken as prescribed.
Assalamu alaikum. I am Faraj Al and I will talk with you about the reason of not adhering to drug therapy. At first, we have so many reasons for not adhering to drug therapy, and one of the example is the side effect. For example, with the diuretics, the patient will notice the side effects of thirst. So, a noticeable side effect like that could cause not adhering to the drug therapy. Secondly, the cost of the medication. When the patient cannot afford the price of the medication, he will consider not taking it at all. Thirdly, the false fearing of for the medication. Here, the rumors will play a crucial part, such an example, the vaccination and the autism rumor. Fourthly, too many medication. Too many medication will cause a mix-up with the patient. Fifthly, depression. Depression will make the patient lose the faith on the ability of medication to cure him. Sixthly, mistrust. When the patient loses the trust on his health provider, he will not adhere to the drug. Is a statistical overview for some of the reasons for not adhering. As it's shown at the first figure, medication prescribed but didn't obtain N is indicated for the persons. N is 12 here. For these reasons, there's some reasons in this figure. Firstly, the patient thought the medicine was not necessary for this condition. There is one person thought that. Secondly, patient thought the medicine was cost too much. There are 3 persons are there. The prescription was not available, out of stock. There is 1. Patient could not get to the pharmacy. There is 1 person. Patient used samples. 1 person. Pharmacy claimed prescription was already picked up. 2 persons. Patient bought medicines abroad. One number. Reasons not stated. 2 persons. There's medication are accompanied with this reason, such as acrobose, atorvastatin, furosemide, naproxen, sitagliptin, oxycodone, and others. The second figure shows a medication prescribed and obtained but didn't use. There's 13 persons here. have their reasons. Firstly, patient thought the medicine was not necessary for this condition. 2 persons. Patient has taken the medicine and it give him or her problems. 5 persons. Patient felt better so didn't need medicine. 2 persons. Reason not stated. 4 persons. And the medication accompanied with this reason: insulin lispro, clarithromycin, lavibutrol, lorazepam, etc. The third figure: medication prescribed, started using, but stopped. There is 35% out here. Patient thought the medicine was not necessary for the condition. 1 person. Patient thought the medicine was cost too much. 3 persons. Patient took the medicine, it gave him problems or her. Side effects, it's meaning. 14 persons. Patient felt better so didn't need the medicine. 4 persons. Physician switched the medicine with the medication. 12 person. Patient thought insurance stopped the medicine. 1 person. The medication accompanied with this figure: acrobose, silkzib, cholestyramine, eye drops, fluvastatin, etc. At this figure, why don't patients take their medicine? The most common reported reasons at this study is the missed dose. The missed doses take 39% of this study. So it's very important to consider that. And by 20%, the late renewal, and the high cost by 16% again, and the clinical question by 15%, and the late refill. Thank you. That's my part. Thank you for your listening.
Assalamu alaikum. My name is Bashir Jalal Ferak again, and I will continue with 5 dimensions of medication non-adherence. 5 factors that affect medication non-adherence. We have 5 factors. Number 1, social economic, and number 2, provider, patient, or healthcare of the patient. Number 3, condition related, and number 4, therapy related, and number 5, patient related. We'll start about social economic factor. Number 1, medication cost. High cost of medication may lead to patient didn't get the therapy because his cost. And number 2, lack of the support of family and social support. Lack of the support for continue the therapy. This may lead to medication non-adherence. And number 3, difficult for accessing the pharmacy. And number 4, lack of the financial resource. Second factor, provider, patient, our healthcare system. Number 1, the poor or lack of good communication between doctor and patient, our healthcare and patient, is one of the most non-medication adherence. So we should improve the communication between doctor and the patient. And we should give all instruction for the patient how use the medication and what the side effect, and continue monitoring and reassess of treatment. Related, for chronic illness, patient decline treatment when no overview symptom. We should explain for the patient why taking the drug and what will happen without the drug, and give all the education of use the therapy. So we should explain the why important of taking the drug for the patient. Number 4, Therapy related, multiple therapy, adverse effect, and lack of rapid benefit, and number of daily dose. This all affect in medication and adherence. So we should choose drug monotherapy with no overview side effect and give rapid benefit for the patient and decrease number of daily dose. Number 5, patient related, physical environment such as visual and hearing and problem in swallowing, especially in old age. This may increase medication of non-adherence, so we should take care about it. And lack of knowledge about disease and importance of taking the medication. So we should explain more for the patient about the disease and why important of taking the drugs. That's my part. Thanks for listening.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdurrahman Muhammad Murzam al-Muntashri, and I will talk about measurement and method of medication adherence. There are three types of measurement: subjective, objective, biochemical. Subjective measurement through asking the patient or their family, also by asking the physician about medication use. Objective measurement through counting the number of pills and review, also examining the pharmacy refill record. Biochemical measurement obtained by examination the level of a drug that present in the blood or urine, or measurement of serum drug concentration. The measurement of medication adherence is difficult due to behavior of the patient to the medication. Now we're talking about the methods of medication adherence. The first method is self-report, which is indirect and simplest method. It is easy to use and provide social behavior and stational factor information. Also, it is inexpensive. The completion of questionnaire or interview are the source of this method. Disadvantage: first of all, based in response and recall, which is limited patient with recall or impact of time. Also, it is not accurate due to patient may over some statement compliance. Finally, validity varies with quality of question and the skill level of interviewer. Electronic adherence monitoring, which is indirect method. This method occurred by attachment of electronic monitoring device to medication container. The medication event monitoring system consists of cap that fit the standard medication bottle and contain computer chip, which that record the date and time of the bottle once opened. The recorded medication event can be transferred to computer for display and analysis, which include dose frequency, which that mean the dose taken daily, dose time, which mean listening of time and date of each bottle opening, dose interval, which is the number of hours that have elapsed since the last opening, dose timing, which is the frequency of days on which dose was taken at specific hour. It's provide information on daily intake, also provide information enabling analysis of long-term pattern. Disadvantage of this method is inaccurate if there is interference by the patient or device, potential for anxiety, reactivity base, and additional cost. The third method is bill count, which is the simple and economical indirect method for measuring medication adherence by counting the number of dosage units, including tablet, capsule, or vials. The disadvantage of this method, medication consumption assumed but not confirmed. There is no information on adherence problem. It requires prescription data. The fourth method is pharmacy refill rate. It can be either direct or indirect method. Direct method because it is objective measurement. Also, it is simple and economical method. It's useful for a large patient population over long term. The administrative database is the source of this method. Disadvantage of this method, insensitive to variation in prescribed use and lag time for data availability. The fifth method, bioassays or biomarker, which is the direct method. This method through lab test of biologic fluid. Advantage, substance easily can detectable. The dose can be obtained. Disadvantage of this method, it is potentially invasive and expensive. The marker not available for many drugs. Directly absorbed therapy, which is the last method and direct method. The source of this method, observation of medication taking. Advantage, direct proof that medication has been taken. Disadvantage, the medication can be hidden in the mouth. Empirical in outpatient setting, especially for long-term treatment.
Assalamu alaikum warahmatullahi wabarakatuh. My name is Bandar Al-Harthi and I will talk inshallah about strategies to improve medication adherence. First of all, efficacy of medication adherence and patient adherence. It is the major factors that is effect on the effectiveness of a treatment to end therapeutic regimen. To improve medication adherence, the healthcare providers, healthcare system, and patient all have a role to improve medication adherence. There is some strategies that help to improve medication adherence, but a single method cannot improve medication adherence, must be instead a combination of various adherence techniques to make a better adherence for those patients. A systematic approach that could be instituted in improving medication adherence include the following. First, can improve adherence by a pharmacy care programs involving education, monitoring, and long-term follow-up that lead to control disease. These programs have been shown a benefits for a lot of diseases, include asthma, diabetes, and hypertension. And there is some example for this program or technology like mHealth technology, medication alert watch, plaster bag, and smart pill container. Second, adherence can be improved with a counseling and explain key information when a prescribing or dispensing a medication. The key information about these drugs like what is the drugs, why use these drugs, and when use this drug, and how use this drug, and how long I will take it. 3. Simplify dosing regimens. For example, adherence is better with a once daily dosing, and also adherence decrease about 10% with the twice daily dosing compared with the once daily dosing, and by an additional 10% for each daily dosing added. 4. If the patient is taking a multiple medication, try to decrease the number of medication if it's possible. 5. Teach patient to relate the drugs taken to a daily activity. For example, those having intentional difficulties in adherence like elderly. 6. Told patient what to expect from their medications and also warning a patient upfront the risk of stopping the drugs and suggesting strategies to deal with the side effects if possible might help them to improve adherence. 7. Help patients to find free or low-cost medications. 8. Introduce a collaborative approach with the patient at the level of prescribing that will improve a medication adherence. Last conclusion. Patient medication non-adherence is considered as one of the most medical problems in the world. And there are a lot of reasons that cause of non-adherence. Thought patient education and motivation is the key to improving a medication adherence. And combination of interventions seems to have the most benefit in improving a patient adherence to their medication regimens rather a single intervention. Importantly, intervention should be designed for each patient as needed. This is my section. Thank you, doctor, for listening. Any question?